My name is Knox Carey. I'm an Intertrust alum. I worked at Intertrust for about 16 years. I'm currently doing some consulting, evaluating investments in healthcare and biotech. The area that's most excited me about healthcare data is data sharing, because I think it's a real shame that there's so much data being collected. The idea that some of that data is sitting idle and not being evaluated and used by smart people to cure disease, I think that's a real tragedy. So I think addressing some of the technical questions around how we share data is a really important issue. Genetic sequencing, for example, is becoming really common, and it's becoming really inexpensive. Because it's becoming inexpensive, people are doing studies of larger and larger numbers of people. It's just not the case that the people that collect the data have all the brain power and the know-how to interpret that data and to derive cures from the data. Right, so we have to look at systems that enable us to share data in a safe way. It is very sensitive and very private data. We want to be able to share the data safely and get it into the hands of the people who know what to do with it. I think recognizing that sharing data is important is maybe one of the biggest challenges. People who collect data, university researchers, doctors, and so forth, they're looking to further their own research. They may not understand the value that data has to people around the world, right? So they may tend to sit on the data, to hoard it for competitive reasons. They don't want the other guy to get the scoop. They may be inhibited by compliance issues. If I hand data over to this other institution, what guarantee do I have that they won't do something untoward with the data? So compliance issues can really hamper data sharing. You also have issues of just lack of standards. There's no common gauge of rail that would let people safely share data between institutions, and so those are all really big challenges that are I think they're starting to be addressed. At least people are aware of them now. So there are a lot of technologies that I think many of them exist that can help us in healthcare. They're just not broadly adopted. In general, healthcare tends to be, technologically, they've tended to be 10 years behind the curve in terms of adoption of new technology. So for example, there are technologies like blockchain, where you have a indelible ledger of things that have happened, and the ability to track data provenance and things like that. Those types of technologies are, I think, really useful in some of these data sharing applications, and they're just now beginning to be explored. I would also list identity technologies. So there's a lot of interest in federating identities, so that when I say I want to share my data, we know who I am, who's making that assertion. Right now, the poster child for genomic medicine, for example, is oncology, because cancer is a disease of the genome. But even so, only 5 to 10% of oncologists actually use genomics as part of the standard of care. I think the pace is, the adoption of new technology is accelerating, and seeing examples of new security technologies successfully applied in other fields, I think, is helpful, but it doesn't make the difference. There have to be studies, and there have to be meta-studies and so forth to prove things out. I've been a participant in an organization called the Global Alliance for Genomics and Health, and that's really a group of experts, a group of volunteers really, who've come together to try to create some of those common gauges of rail, to make sure that, for example, file formats for certain data types are well specified and consistent across institutions. That type of stuff can be, tedious work, getting everybody on the same standard, but really you can't share data without those types of supporting technologies. And so I'd say the Global Alliance for Genomics and Health is really a fantastic organization that's promoting data sharing. I think you can expect some of the work product from the Global Alliance for Genomics and Health to make it into practice. The thing I suppose I'm really the most optimistic about is cures for really rare diseases. Right now, rare diseases suffer inordinately from the non-dissemination of data. So someone may have a data set with a particularly rare genomic variant that's not known by anyone else. So it stays put, and as long as there's not a second case that can be compared, nobody can get a handle on what's going on. And so the technologies of data sharing, that allow multiple researchers to start to compare notes and to see commonalities across data sets, I think that's really, really important. Secondly, I would say for oncology, and this has already happened for some types of cancer, childhood leukemias, for example. I think most cancers in 10 years' time, 15 years' time maybe, will be treatable sort of chronic conditions as opposed to death sentences. So in one case for acute myeloid leukemia, a drug called Gleevec has taken what was almost like 90% certain to be a death sentence for kids to 95% survivability. There's some amazing things that are happening in oncology, and that's really facilitated by data sharing.